I'd like to talk to you today about bed capacity in UHL. Since the start of the pandemic, we have added 98 inpatient beds and 10 critical care beds in UHL. The new beds have enabled us to keep vulnerable patients safe, including haematology oncology and renal patients, and to provide a safe pathway for people attending UHL for surgery and to isolate COVID-positive patients. It is unfortunate that the additional beds have not had a greater impact in reducing the number of admitted patients waiting for a bed. The pandemic and the record number of non-COVID patients presenting to the hospital are factors in explaining this. The ED in UHL is the second busiest in the country, and last year we saw an increase of 7% in presentations when compared to 2019, the last full year pre-pandemic. 8 out of every 10 patients we care for in UHL are emergency admissions. This leaves limited capacity for elective activity, which results in longer waiting lists. Last year, UHL provided more inpatient care than ever before. The number of inpatient discharges in 2021 increased by 6% compared to 2020 and by 13% compared to 2019. Our next significant project in terms of bed capacity is the 96-bed block for UHL. I anticipate that the contract for the work will be awarded shortly, and in the coming months will go before the HSE board for approval and funding allocation. The plan is for approximately half of these beds to be used to replace older wards on the UHL site. This will allow us to move away from Nightingale wards to single en-suite rooms, which is important for infection control. Of course, in addition to increased bed capacity, reducing overcrowding in our hospitals depends on a whole system approach around integrated care, admissions avoidance, community access to diagnostics and patient flow, all of which are committed to under staunch care. I hope you can join me at our next staff webinar on Wednesday the 16th of February. If you have any questions for me or my team, you can ask a question live on the day, or you can also submit a question in advance. Thank you.